predicting post-resection persistent hydrocephalus in pediatric patient with posterior fossa tumors using Canadian preoperative prediction rule for hydrocephalus, CPPRH scale. You have 3 minutes to present. Please, Dr. Sehrish.
Hello, assalamu alaikum. Hello.
Walaikum salam.
Hello, good afternoon, everyone. I'm Dr. Sehrish Altaf from Hamdard University Hospital. I'm working as Senior Registrar in Neurosurgery. And I have the privilege today to present on the topic that is predicting post-resection persistent hydrocephalus in pediatric patients with posterior fossa tumors using modified Canadian preoperative prediction rule for the hydrocephalus CPPRH scale. So as we all know that the posterior fossa neoplasms are the most prevalent neoplasms in the pediatric patients, and these tumors lie in the close vicinity of the fourth ventricle. So the main controversy is whether to treat the hydrocephalus before the primary tumor resection, since the prophylactic CSF diversion procedures may expose about 70% of the individuals to the unnecessary risk. And the CPPRH scale was developed in an attempt to categorize these patients based on their likelihood of experiencing the postoperative hydrocephalus following the removal of the posterior fossa tumor. So this is the modified CPPRH scale, which includes the age less than 2 years, points given as 3, presence of transependymal edema, moderate or severe hydrocephalus, cerebral metastasis, again the score will be given as 3, and preoperative estimated tumor diagnosis given the score 1 each. So the total possible scoring will be 10. So we included the patients with less than 18 years of age with new radiologically confirmed diagnosis of posterior fossa neoplasm and who subsequently underwent resection were included, while the patients who undergone this pre-operative resection treatment, permanent CSF diversion previously, and the patients with pre-existing hydrocephalus or the patients whose data were lost were not included, and those patients who died within the 6 months of tumor resections were not included. We divided the patients into 2 categories, that is low risk with a score 0 to 4 and the high risk with a score between 5 to 10. The patients were followed for next 6 months, and so this was our result. Our result showed that the patients with the CPPRH high scale, that is 31.3% of the patients, most of the patients, that is 28.4% of the patients, needed the post-resection CSF diversion, while the patients with the CPPRH low risk, that is a score with the 0 to 4, only 6.8% patients needed post-resection CSF diversion. So this was our result, and so we concluded that the CSF shunts are associated with the, as we all know, myriad of potential complications and can lead to upward herniation or intratumoral hemorrhage in case of posterior fossa tumor. So the CPPRH is a valuable tool, and its main purpose is to separate the patients into high and low risk groups in order to aid in the patient counseling, customize our treatment plans according to the CPPRH scale, and to adjust the level of post-operative hydrocephalus monitoring, and to prevent the patient from unnecessary shunt dependency and unnecessary shunt-related complications. Thank you.
Thank you very much for sticking to